Stool, the question of what lab do I use for stool testing, and there's so many that you can use, and I've used a lot of the different ones, but I tend to go back to BioHealth. It's one I usually use because I find that it catches H. pylori a lot more than the other labs do. It catches parasites really well. It's not the best if you're thinking about candida though. I never see a positive candida with that. So if you want to do one that's more specific for candida, diagnostics would probably be a good option. Also metametrics is really good. And then I like doctor's data too. So there's a lot of different options, but I just tend to go back to BioHealth. I don't know, I'm just drawn to it, so I like it. Yeah, I use SpectraCell. The question is, do I ever use SpectraCell? SpectraCell is a lab that does all kinds of lab testing. One panel I do through SpectraCell for every single patient is micronutrient testing. So I look at the vitamin and mineral status, which is within the white blood cells. So it looks at vitamins, minerals, it looks at antioxidants, and then it takes those antioxidants and actually challenges them and they see how well they stack up against free radical damage. So I do that on everybody, and that's part of that replenish process. So if that's anything's deficient there, we always address that for like 3 months, and then we retest and see how they do. So yeah.
Question about your detox program. What is your detox?
Yeah, so the question's about the detox program. So the one that I use is through Apex Energetics. I've done a lot of training with them. I've seen a couple people here have been to the seminars, and that's the one that Shelly and I, we do that, a lot of the same seminars. So if you are a practitioner, I recommend to go to the trainings because I learned a ton through them, and probably more there than in medical school. I learned a lot in medical school, but I learned a lot through them and just really practical stuff. But I use their detox program. It's called Detox 360. It uses it's a rice-based protein. In general, I'm not a huge fan of grains, but I find that people tolerate it really well. And it has phase 1 and phase 2 liver support for detox. It also has lots of antioxidants in it. It's like a multivitamin too, so it's medical food, but it also has, a good source of protein. So I have them do that. And then there's a liver supplement called Metacrin. It provides a lot more liver cofactors. And then there's a green strength that comes with it, fish oil. And then there is also homeopathic remedies that help with drainage, whether it's, it includes liver, kidneys, and lymphatic drainage. So I find that, colon cleanses are great, but you don't really support all the emunctories, so really supporting the routes of elimination. And they, you don't want to keep recirculating toxins. You make sure you're clearing it out. So I do that for 3 to 4 weeks, like really hitting it hard. And yeah, it works really well. I like it a lot. There's, you can do detoxes through lots of different companies. That's just one that I use.
How often would you recommend doing a detox?
So the question is, how often do you recommend doing a detox? I recommend at least every 6 months.
A week detox, or like 10 days, 1 day?
How often? So, or how long is it? It's a 3-week detox. So I recommend 3 weeks every 6 months. I mean, we are in such a toxic environment. You can live in the North Pole and you're still going to have toxins. So, I mean, it's a great idea to do it on a regular basis. Yeah.
Saw a hand in the back there.
Do you treat patients that have idiopathic hypothyroid as autoimmune, even if their antibodies are negative?
The question is, do I treat idiopathic hypothyroidism as if it's autoimmune, even if the antibodies are negative? Well, sometimes the antibodies will be negative even when they do have Hashimoto's. So if they're so immunocompromised, so immunosuppressed that they can't even mount an immune response and they can't create the antibodies, that's possible. So an example of this would be my mom. She's been on Synthroid for 20 years, and she always had antibodies negative, and just this last year she has positive antibodies. So maybe she just couldn't mount an immune response, or maybe she just developed it. I don't really know. So we switched her to compounded thyroid and she was on Synthroid forever, and I thought you had to stay on it, but we switched her and she's doing really well, and we're just working on the immune process now. So I would test it, but I just test everybody for gluten sensitivity also. I'm a fan of testing, I guess.
So what test do you love for gluten sensitivity?
Okay, so I'm really glad you mentioned. So my favorite panel to do for gluten sensitivity testing is through Cyrex Labs. So Cyrex Labs, they offer a bunch of different panels, but they have the very best gluten testing. When you usually get gluten sensitivity ran, they do alpha-gliadin, which is one part of gluten. And it tests for alpha, it tests for gamma, it tests for omega, it tests all different types of gluten, proteins. And it also looks at wheat germ gluten, and it looks at deaminated. I mean, there's so many different types you can be reacting to, and so it's a very comprehensive panel. So it's like $300 or so. It's kind of expensive, but it's worth doing. So I go through them. And then also one thing I didn't mention too is Cyrex has a really amazing antibody panel. So if you have any family history of autoimmune disease, if you have Hashimoto's, if you have any kind of weird symptoms, any infertility issues, I recommend to get their antibody panel. So it looks at antibodies to different body tissues. You can have antibodies to ovaries. That's something I forgot to mention. So you can actually have an antibody response to your own sex organs. And so that's something we can test and we can work on, working on the inflammation in that whole autoimmune process. So I think it's probably a lot more common than we think. That's array 5, and it's like $500 something. So it is expensive, but if women are, IVF is a lot more expensive, so people will throw down the cash if they find out what's happening.
I have a quick question to all 3 panelists. Maybe each one of you can kind of say, how long do you generally work with a patient that comes in with these symptoms, someone who's trying to get pregnant and is experiencing some infertility? What kind of time frame are you looking at as far as treatment?
Well, for myself, I go on 3-month increments. So any treatment they come in, I always tell them this is for 3 months. We retest, we see how you're doing. So, at least 3 months, but 3 months to a year, can take.
So mine is more of a defining problem that I'm really just trying to get that TSH close to 1, which can be done usually in 4 to 6 weeks. Maybe it takes another 4 to 6 week period if we need to increase the dose or so.
Hello. As far as I'm concerned, I pretty much do the same thing that Laura was talking about. It's 3 months as a starter, because usually even in Chinese medicine we'll say give the menstrual cycle at least 3 times around to be able to see what's happening with it. And you can also see with a BBT chart, I try and get them on that right away so I can see how much changes are happening. Because a lot of times you can even look at that besides what their symptom picture is, but you'll start seeing changes happening there, and you'll see how close they're getting or not getting, and then you'll know how much more you're going to have to go with. And of course, you're still looking at their symptom picture, and doing labs is also really helpful if you have them like a starter, one that's a baseline that they recently had before coming in, and then something you can go on off of later too, just to see how much they've improved.
Over here, and then we'll go to the back.
Only one of you mentioned stress and its relationship to infertility. I was wondering if the other 2 have input about that.
I think it's strongly linked. There's a lot. I feel like that stress affects all your systems.
I think it's very strongly linked to infertility. Absolutely, I think stress impairs a lot of your systems, reproduction being one of them. I think the pituitary itself is pretty sensitive to stress, and then a lot of your axis can be off.
So do you refer out to somebody who can help with stress, like hypnotherapy or anything like that?
Absolutely, I would. I think all these modalities are very complementary.
I think I mentioned stress.
Oh, yeah.
Stress is definitely huge, and so the more you can work on with them and or explaining at least the importance of them doing some things to change it up. But if they can get counseling, I think the hardest thing is a lot of people have gone through the gamut of a lot of different things already by the time they come and see a natural practitioner or someone doing acupuncture or even naturopathy, and so they may have already spent a lot of money doing testing and everything else, and so they don't always have like a lot of additional money to potentially put out towards counseling. So it's like trying to find what you can do personally for them or recommend that they might be able to do financially. And so it actually would be nice to have a list of people that are more affordable type of or sliding scale, because they spend so much. It's like such a huge area. Yeah, stress is big.
In the back?
Shelly, you mentioned a couple of things that I've kind of forgotten with thyroid testing. Could you just go through a quick list of things to not forget when you're wanting to get someone's thyroid now? You mentioned reverse T3 and something.
Okay. Yeah, normally I said, that TSH and your T4 is a lot of times what you'll see on the test that they'll do, maybe just TSH. But the free T4, the reverse T3 is also a good one to make sure that they have. Free T3 as well, yeah. Yeah, she had mentioned before when she said, is it the TB, we had to check with the thyroid bonding globulin, yeah, TBG, when she said that earlier. It's like, yeah, you're basically wanting to make sure everything's converting, and so if you get all those different tests done, you'll have a better idea of where there may be problems in the conversion, like where is it happening, where's the problem.
With that testing, as far as I know from the tooth crossing process at Efect, I don't remember their detail, but from your expertise in infertility, would you say there's a certain time of the cycle that would be better to test the thyroid? I've just never heard it addressed before, but I know I feel really different at different times in my cycle, and that would affect what the results would be.
And some of these numbers, like the total T4, and the ones that are more related to your binding globulins that are going to be sensitive to your fluctuations in estrogen that change during your menstrual cycle, those might fluctuate more. The TSH is the most sensitive because that's really your brain is telling you if it's happy with what it sees, and that one doesn't fluctuate, and it has nothing to do with the binding globulins. So really the TSH is the most sensitive. It's not the whole picture, but it's the most sensitive and it's the most consistent. So that one doesn't really depend on the time in the menstrual cycle.
I would also just add that maybe it's just best to test the same time every month, just so you compare apples and apples. So, yeah, that's a great question. I've never even thought of that.
All right, another hand in the back there.
So what is the connection between coffee and thyroid? Coffee and thyroid. What was the connection?
The question is the relationship with coffee and thyroid. Now, Shelly just mentioned the cross-reactive, and that's possible too. If you have an autoimmune issue, you could be reacting to coffee as if it was gluten, so that's a possibility. But there was something in particular, and I believe it's connection with iodine's interaction with the thyroid. I think that's what it was.
Caffeine raises estrogen or lowers progesterone. So hormonally active.
Yeah, so it could be the action on estrogen and progesterone. And also coffee leads to insulin resistance. You know, it really affects the adrenals. I mean, I'm not a fan of coffee. I take everybody off of it. You know, I have it when I have to have it, but I was having to switch to green tea. But yeah, so if you have any blood sugar fluctuations, that's going to throw up adrenals, and then that affects the conversion of T4 to T3. So it affects a lot of different parts of thyroid physiology, I think. So, but it's delicious.
I was just going to add something. We're talking about Cyrex is actually the company that does the arrays, and she was mentioning the one that goes through a lot of the different aspects of gliadin. They also have an array called, it's an array 4, and it tests on the cross-reactants. So if you're trying to figure out specific foods as like sesame and casein, and there's like some other specifics that are in the list, and coffee is one of them. It can be a cross-reactant, so you can always test and see if that's a factor for you. But it also lists at least like 24 different kind of compounds in that, so you can see if potatoes, rice, eggs. There's like a lot of common allergens that people have, and you can see if it comes up for you, because if it does, then that may also be causing more, you know, reaction in your system. So.
Yes, in the back.
Okay, I have a question. I'd like to address to the MD, but I'd like to hear from everybody is when a couple present for infertility, what do you see statistically? Is it you know, what's the percentage of that the problem is actually a male fertility problem as opposed to a female infertility problem?
Well, I'm not a fertility specialist. I'm an endocrinologist, but there's I want to say it's like 60-40 female male, and the majority of the female problems are ovulation problems. I think 40% of female problems at least are ovulation problems. So.
I remember hearing about the same statistics, like 40-60 or 70-30 or something like that. So largely the woman, but it's worth checking the guy. It's easy to do. So get in here and test those little spermies.
No, and absolutely. I did rotate through infertility clinic when I was a fellow, and really, there's no point in going past a certain point with the female until you check the male. You're not going to start any procedures or anything without checking. It's an easy enough test to check, and really, it's half the battle. So.
I've even heard some urologists say it's almost 50% sometimes with male factor problems. And so it really does make a difference to check. And nowadays they don't really do a postcoital test, which they used to do in the past, just to see if there's a problem with the male and female together, like the sperm versus, the vaginal, excuse me, I can talk, secretions that they might actually be killing off the sperm. And so before we even get inside. And so they used to do that testing really more commonly, and now they don't because I think they're ready to always go to the next jump, like let's do IUI or let's go IVF. But there's definitely a high percentage, and whenever I know, it's like sometimes it's really hard getting the male in the clinic. That's probably the hardest one. And then some of them are more willing than others, they're not all bad, but trying to get them also to do herbs can be difficult. But it's really worth it because you're right. It's like you get the woman and everything going on, and then all of a sudden you find out that the guy has got serious issues. And I had that happen before, where they were finally getting the gal in a good place, and we finally had him go get a sperm analysis, and he's like azoospermia. He has no sperm present. He had been taking all this testosterone, trying to help elevate his energy level, which had been really low, and it took it to the extent where he stopped producing sperm. And so he had to get off the testosterone. We had to give him lots of herbs and really change things up quite a bit. So yeah, you definitely have to get tested. Yes.
Yes, right here in the front.
So there's generally the perception that once you're on thyroid hormone, you're always going to be on thyroid hormone. How do you guys help you work with patients that want to start getting off of the thyroid hormone?
The question was, I'll just restate it. The question was, if you've been on thyroid hormone, can you get off, and what are the kind of complications there? Or yeah, maybe just kind of an overview of what you've seen with patients.
To me, I think it largely depends on the cause of the thyroid deficiency. Obviously, if I take your thyroid out surgically, it's going to be hard to get off of it. But if it's one of the autoimmune processes, again, it might be unlikely, but I'm all for patients, if they really want to try, absolutely to try these other modalities, to try to get everything else in balance and see, it's worth a try if the patient's very motivated.
I would agree with that. Definitely looking at the root cause of why they have to be on the thyroid in the first place. That's why I always really try to do as much as I can before prescribing thyroid hormone. So if I can optimize it, using detox or with diet or using nutrients, I will do as much as I can beforehand. So if they're already on thyroid though, oftentimes we can actually lower the dose, depending on some lifestyle stuff and naturopathic treatments. But a lot of times they do stay on it, and it's just they're happy to because they feel so much better when they're on it. So it just depends on the patient. But most people, the majority, probably do stay on it. Yeah. I'm okay with it because I feel amazing with it. So, but yeah, most people do. But a lot of times we do get to lower the dose too. And I did work with one doctor up in Portland, and she would use high dose iodine to detox the thyroid. She was saying she was getting patients off of it all the time, but we tried it, and it didn't work for me, so I don't know. And then with the whole autoimmune issue, I just really question that. So, but yeah, I reduced the dose a lot for some patients, and then a few of them get off of it, they just don't need it anymore, so it just depends.
With Hashimoto's, my understanding is just to diagnose that it's just the positive antibodies and a certain level of the and high TPO. Is there anything else that you're looking at to make that diagnosis?
Well, to make the actual diagnosis of Hashimoto's thyroiditis, you have to have your TSH elevated and you have to have positive antibodies. Oftentimes, you don't have a TSH elevated, you only have antibodies. And so you don't diagnose Hashimoto's thyroiditis or even hypothyroidism, they don't have that. They just have an autoimmune process happening. So you can't actually get that diagnosis. And I'm right on that, right? Okay, so you should the diagnostics. But again, too, this is one thing with Hashimoto's that I didn't mention is that you get fluctuations in TSH. So if you were to test it every month for a year, you probably see a TSH at 8, then you'd see TSH at 0.3, then you see it at 2, and then you'd see. So it goes all over the board. You cannot trust TSH when it's an autoimmune process. And also, too, we've noticed, too, that when a person is exposed to gluten, that creates an autoimmune process, and that can make their TSH, off based on that, too. So.
Did you say antibodies? Do you mean like high
C-reactive proteins and stuff like that.
Yes, the question is, what do you mean by antibodies? So the specifics are TPO antibody, and it's thyroid autoantibodies. So those are the two main ones, which is the same as thyroid globulin antibodies, the thyroid autoantibodies, the same thing, right? Well, for Graves, that's the thyroid stimulator, yeah, so it's TSI or TSH antibody, yeah. Yeah, so those are two mains, the TPO antibody and then TAA, thyroid autoantibodies, same thing as thyroid globulin antibodies, is the two.
I was just going to say with Hashimoto's too, it oftentimes is going back, first talking about the, as far as like the levels with TSH, it might also be the symptomology seeing hyper and hypo. Like maybe they have symptoms some days of things that are more heat reactive, like, you know, like the symptoms of hyperthyroid is more like maybe getting hot flashes or night sweats or insomnia or agitation, racing heartbeat, palpitations, things like that would be more hyperactive. And so they might have like days where they have symptoms like that, and then symptoms where it's more the opposite, which is more hypothyroid. Because with Hashimoto's, you can have it where it's kind of pinging back and forth. So that might give you more of a clue in too. Because like she's saying, is like it's a snapshot. You get the blood lab and it's one day. You go take it like 2 days later and it may be completely different. So.
We have probably time for 1 or 2 more questions right here.
How did you do the heavy mental detox?
The question was, how do you do heavy metal detox? So for heavy metals, I use oral chelation with DMSA, oral DMSA. And so what I'll do is I'll do pre-testing where it's through a urine test. They collect their urine and then they take an oral chelator that binds to the metals and then they urinate that out and then they collect their urine. Then you can compare the two, and then based on whatever their results are, you do a detox using the same agent, which is an oral chelator. Also doing lots of detox and making sure you're having your stool moving properly, and also too they have to get the amalgams removed. They have to get the root cause addressed, otherwise they're just going to continually expose themselves again. So it's important to go to a dentist that knows how to do that properly. They want to use a particular type of dental dam. They want to use it's a suction type of device that pulls any of the vapors coming out of the air. It takes that too, and so because that's a huge source of exposures when you get your fillings removed. So yeah.
What's your dentist, the dentist that you work with?
His name is Dr. Stephen Lawrence, and he practices in Carlsbad. Yeah, Stephen Lawrence. And if you do go to my website, you can get the link to the radio show. I interviewed him, like an hour-long interview, and it's my favorite show because it was fascinating. It was so much I learned, and just crazy. The whole holistic dentistry thing is really amazing.
Cilantro is good too for detoxifying.
Yeah, cilantro.
I saw voting hand in the back, and then we'll come up here to you, Fred, okay?
Is it possible to eat too many seaweed products? And if so, what would be the symptoms? You're all smiling out there.
Just when we were talking about Hashimoto's, because I'll use myself as an example, because I have a thyroid insufficiency, I have hypothyroid, and so I was trying to treat myself naturally and not be on Synthroid, trying to not go that route. And so I was taking an atomic iodine as well as like a glandular thyroid supplement, and I thought I was doing fine, okay? And then later I finally got my blood labs done. I felt good. I mean, I actually felt better than I did before when I had a blood test done in the past. It had a just slightly elevated TSH level. Well, after doing this and finding out pretty much positive of Hashimoto's, my TSH was through the roof. I mean, it was, like you said, like the high side of normal is about a 5. Mine was 120, okay? And that was from doing iodine. And that's like it's shooting yourself in the foot. It's just making your body attack, the thyroid even more. It's like putting up a little flag here saying, attack me. Okay, so that's the bad thing about doing too much or too much seaweed or doing too much iodine. If you do have an autoimmune problem, I'd say to be careful of that. At least test first before you decide to treat yourself in that manner.